Welcome to the Distinctive Dermatologist, the podcast for professionals in dermatology. Our goal is to help your practice stand out and deliver the ultimate experience for your patients, so they schedule repeat visits and refer your practice to their friends. We're here to help your practice become more profitable. Here's your host, 7-time best-selling author, in-residence faculty member at High Point University, Hall of Fame professional speaker, and member of the Sales and Marketing Hall of Fame, Scott McKain.
Welcome to this week's edition of the Distinctive Dermatologist. I'm Scott McKain, and there's an interesting challenge in healthcare today. Patients have access to more information than ever before. They can search symptoms, treatments, physicians, reviews, and alternatives before they ever walk through the door of your practice. But access to information isn't the same as understanding. And that creates an important opportunity for dermatologists and their teams. And it's part of the reason that GentleCure from SkinCure Oncology brings you this episode. Because one of the most powerful ways you can create a distinctive experience and an exceptional patient experience is through education. That begins obviously with the dermatologist continuing to learn, but it extends much further than that. It's about how you translate your knowledge into information that patients can readily understand. It's about understanding what patients are telling us that they want from their experience. And it's about recognizing that everyone who interacts with a patient has an opportunity to educate, reassure, and build confidence. That's our focus on this week's episode of the Distinctive Dermatologist. We're going to hear from several leaders in the profession about different aspects of education and the patient experience. And I think you'll find that while their perspectives are different, they all point towards a remarkably similar conclusion. Let's begin. Medicine never stops changing. New research emerges. New technologies become available. New treatments create possibilities that simply weren't available a few years ago. And that means expertise cannot be something we achieve and then simply maintain. It requires continual investment. I recently asked Dr. Bob Haber of Cleveland about the importance of continuing education for dermatologists and why staying current matters not only to professional development, but ultimately to the patients that you serve. Here's what Dr. Haber had to say.
Look, we are educators and we are learners, we're teachers. So when a new drug comes along, we read about it, we learn about it. Is it as good as the rep says? Not necessarily, but it's good for certain situations. So it's our responsibility to educate ourselves about every new treatment, whether it's a drug or a surgical procedure or whatever. Don't believe someone who has a negative bias towards something. They're using ancient data to convince you of something. Educate yourself. There's enough objective information out there. I've published a lot of it. There's more coming. Visit an office, come by my office, watch it, talk to patients, and you'll see that once you become familiar with something, it's no longer scary or bad. It just becomes a choice you can give your patients. It's very, very important to do that.
Dr. Haber makes an important point. Continuing education isn't separate from the patient experience. It's one of the foundations of it, because patients reasonably expect that the professional they trust with their care is aware of the latest developments and can help them understand what those developments might mean for them. But that raises another question. Having knowledge is one thing. Communicating that knowledge effectively to a patient is something else entirely. And that's where I wanted to bring Dr. Billie Cassé into the conversation. Dr. Cassé has built a successful practice in the Reno Tahoe area, and when I recently spoke with her, I asked her about something that I believe deserves much more attention in discussions about the patient experience. How do you educate patients without overwhelming them? Because most patients aren't looking for a medical school lecture. They're looking for clarity. They want to understand what's happening, what their options are, what you recommend, and what they should expect next. Here's Dr. Billie Cassé on how she approaches patient education.
So my job is to basically bring education to everybody, so I look at my practice and myself in general, just being out there, bringing dermatology, what can you do at home type situations when you can't actually get into the dermatologist. What can you do? Like I said, there's so many people, and I think it's fascinating that, people watch different programs because they want to see a pimple being extracted, right? Or surgery being done. But it's those programs that actually are educating people, because there are people at home that didn't realize they could have that done, Yeah. So I feel like my job and the job of others is really to get out there and just let people know that, hey, there are so many things that we can do to bring back your confidence, to make you feel better, to, bring you back out to your best life, honestly.
The distinction is very important. Education isn't simply giving patients more information. It's helping patients make sense of the information. And when we do that well, something important happens. Uncertainty begins to decline and confidence begins to increase. That matters because the patient experience isn't created only by what happens clinically. It's also shaped by what patients understand, how involved they feel in decisions about their care, and whether they believe the practices listen to what matters to them. Which brings us to another important question. What do patients actually tell us they want? Josh Swindle is the Chief Operating Officer of SkinCure Oncology, the company behind GentleCure. Because of the number of patients in dermatology practices that GentleCure works with, they have access to valuable information about patient preferences and expectations. Sometimes the things patients value aren't necessarily the things we assume they value most. So I asked Josh to share some of the data they're seeing about what patients want from their dermatology practice. Listen to this.
There was a recent quality of life and quality of care survey done, and it asked a question. It said, what matters most to patients, right? And I'm kind of generalizing here, but what matters most to patients? And the top 3 things that matter most to patients are cure rate. That's no surprise. Second most important, avoiding surgery. And third most important is their cosmetic outcome with their intervention. I thought that was just mind-boggling. When you're looking at thousands of patients that have participated in this survey, they want a good cure rate. They want the best cure rate. They want to avoid surgery when they can, and they want their cosmetic outcome to be good. And Scott, I know you and I have talked about some of the, the shift in the human, behavior to become very, very cosmetically sensitive. And this shows exactly that, and when you look at the, 10, 15 items, and these are the top 3, it just validates that patients want great cures, they want to avoid surgery, and they want a good cosmetic outcome. That I found very interesting as I was actually reading a recently published paper. I'm going to bring this up too so that I don't mess it up, but it's an appropriate use criteria. It was put out by the American Radium Society, and it's an appropriate use criteria for low-dose radiation therapy for osteoarthritis. And I happen to know, one of the authors on there, awesome radiation oncologist, great individual. What was really interesting about this, though, is there was a patient advocate statement in there, and I thought that what a nice shift. To have something that is an appropriate use criteria that also involves the patient advocate within their research and, essentially, scientifically backed evidence to say, hey, they are advancing and advocating on modern techniques to make sure that when it comes to everything we do from an appropriate use criteria, that we always have the patient in mind. And so I would highly recommend, any of the listeners to take a look at that paper, because I thought that was such a wonderful shift in published research by physicians that they actually had a patient advocate statement.
It's important information because there can sometimes be a significant difference between what we believe creates a great patient experience and what the patient actually experiences as valuable. And ultimately, the patient gets to define the patient experience. The practice can design the process, can establish the standards, can train the team, but the patient determines whether those efforts created confidence, clarity, and trust. And there's another dimension to this that deserves our attention. The dermatologist obviously plays the central role in the patient's experience, but the dermatologist is not the only person creating that experience. Every interaction matters. For patients receiving GentleCure, one of the people who may have significant contact with them throughout their treatment is their RTT, their radiation therapist. And because that relationship can develop over multiple visits, Radiation therapists occupy a particularly interesting position. They aren't simply involved in delivering treatment. They can become an important source of reassurance, communication, education, and continuity for their patient. John Klade of GentleCure has seen firsthand the impact radiation therapists can have, not only on the patients, but also on the dermatology practices where they serve. Here's John.
Unlike a lot of the other professions in the health field where you may see a patient 1 to maybe 5 times tops, and you never see him again, you never find out what happens to him, you're just there explaining the procedure, and that's pretty much it. But with radiation therapy, a lot of these patients, there are patients who will come 40 times for their treatment. So you really get to develop a relationship with a lot of these people. And that's like what I said, that what I truly enjoy about the position is just really getting to know people. Their family members, that their grandson is playing a t-ball game Friday night. So, to ask them about that on Monday morning. They know that you like to pick mushrooms and you like mushrooms. So then the patient ends up bringing you a brown paper bag full of mushrooms. So that's something that's really special about this field, is just really getting to connect with patients on a whole nother level. I would say the biggest elements for any practice really comes down to trust and how you build that trust through communication with the patients, respect from the patients, really giving the patients a fully informed consent. I've seen so many times and heard so many stories where a patient comes from another dermatology office because that dermatology office said, all right, you have a basal cell on your cheek, let's set you up for Mohs. And they just say, okay, let's do that. I guess that's the only option. So then they go home, they do their research, they find out that there is a non-surgical option for their basal cell on their cheek, and they come find a practice that offers GentleCure. So they go to that practice and they learn like, oh my gosh, I'm a candidate for this type of treatment. Why didn't my other dermatologist tell me about that? I no longer trust that dermatologist. So now not only has the patient lost trust with a healthcare provider, they found a new treatment and they have gained a lot more trust in a practice that they just randomly found because that practice offers an alternative. We're not saying that Mohs surgery is bad. We're not, no one is saying that, but we just want to make sure that the patient understands that they have options. And if a practice doesn't offer all of those options, you're going to lose trust in that patient.
I really appreciate that perspective because it reinforces something we discuss frequently on this program. The patient experience is a team sport. Patients don't separate every interaction into neat organizational categories. To them, it's all part of the experience. The physician, the front desk, the clinical staff, the person answering the phone, the radiation therapist. Every one of those interactions can either strengthen confidence or create uncertainty. And when everyone understands the role they play in the experience, something powerful happens. The patient doesn't merely receive good treatment, they feel well cared for. We'll continue our conversation in just a moment. First, a word from our sponsor, GentleCure.
I started playing golf when I was 10 years old, so I've been in the sun my whole life.
Last year, we noticed a spot on Brian's lip. We were very concerned, and we went to a dermatologist.
When I found out it was skin cancer, I was in the middle of a tournament. The dermatologist was recommending surgery, so I was going to miss time on the tour.
I saw a commercial for a treatment called GentleCure. It didn't require surgery and meant no time away from golf.
If you, like millions of others, are affected by skin cancer, it's important to know that surgery isn't the only option. There's another choice, GentleCure. GentleCure uses low-energy X-rays to kill cancer cells with a 99% cure rate. There's no cutting, no surgical scarring, and no downtime.
Thanks to GentleCure, my cancer is gone, and I didn't miss any time on the course.
We've been fortunate. We wanted to use our platform to get this message out. There are options, and patients deserve to know.
To learn more, call today or go to GentleCure.com.
Welcome back to the Distinctive Dermatologist. I'm Scott McKain. We talked today about education from several perspectives. Dr. Bob Haber reminded us of the responsibility dermatologists have to continue educating themselves. Dr. Billie Cassé discussed how that knowledge can be translated into meaningful patient education. Josh Swindle shared data about what patients are actually telling us they want from their dermatology experience. And John Klade helped us recognize the important role radiation therapists, by extension your entire team, can play in creating confidence and delivering an exceptional experience. Before we close, though, I wanted to return to Dr. Cassé for one final thought, because ultimately all of this comes back to the relationship between the dermatologist and the patient. Here's Dr. Cassé.
The good news, it's all about increasing patient care, honestly. And again, whether it's skin disease to cosmetics, there's so much innovation in dermatology right now. It is super exciting. I mean, the fact that we've got medications that we can clear people's skin of full body psoriasis or eczema, with injections, we can see 100% improvement. Also with improving, arthritic type of issues that go along with these. Up into, now, we're looking at patients that are 60, 70, 80 that you thought were 40, 50, like all the things that we have in lasers. I mean, the technology in lasers has been absolutely amazing. And the fact that we can, help your body really increase collagen production, let's collagen bank, let's decrease, your fine lines and wrinkles. There's so many things that are happening in dermatology that I really feel like the innovation is just continuing, that we are able to, like I said, get rid of some of these diseases that before we had people in the hospital for 2 weeks doing, tar baths and things like that, and UVA light. So I just feel like the innovation is absolutely fantastic. I feel like that is going to keep growing and going. We are able to now non-surgically treat skin cancer, so with GentleCure. And I just feel like this is just going to keep going and going and going. And we're going to have less, things that we're going to have to do as far as, surgical, honestly. Mm-hmm. I mean, there's always going to be surgery, but you know what I mean? The fact that we can now give people an option of something more, I think is going to be the trend.
Yeah, absolutely. There's a phrase I used earlier that I want to return to. Access to information isn't the same as understanding. In fact, I'd suggest that as patients gain access to more and more information, particularly in this age of AI, social media, online forums, and endless search results, the dermatologist's role as a trusted source of clarity becomes even more important. The distinctive practice doesn't merely provide information, it creates understanding. It doesn't simply tell patients what treatment they're going to receive, it helps them understand their choices, what they can expect, and why a particular course of treatment may be appropriate. And it recognizes that education doesn't belong exclusively to the physician. Everyone who touches the patient experience has an opportunity to reduce uncertainty, build confidence, and reinforce trust. That's an important distinction, because clinical excellence is obviously essential, but patients cannot always evaluate clinical excellence the way that another physician could. But what they can absolutely evaluate is whether you listened, whether you explained, whether you answered their questions, whether you gave them choices when choices were available, whether your team treated them with respect, and whether they left your practice feeling more confident than when they arrived. That's where education becomes more than the transfer of information. It becomes an integral part of the experience. And that's one more way you can build a practice that patients trust, return to, and recommend. My thanks to Dr. Bob Haber, Dr. Billie Cassé, Josh Swindle, and John Klade for sharing their perspectives with us. And as always, our thanks to GentleCure for supporting the Distinctive Dermatologist and our continuing mission to help you create a practice that stands for something meaningful in the lives of the patients you serve. I'm Scott McKain. Thanks for listening and watching, and I'll see you next time on The Distinctive Dermatologist.
Thanks for listening, and join us next time for The Distinctive Dermatologist with Scott McKain.